This is Future Fork, a show that explores the world of food and the decisions we can make today that will shape our future. On the show, you'll hear from innovators in the food space. We'll have disruptive conversations with people from around the globe who are taking the lead on topics like food sustainability, ending world hunger, food security, and so much more. I'm your host, Paul Newnham. In this episode, we're talking to Meera Shekar. Meera is the global lead health, nutrition and population at the World Bank. Meera is a key authority on nutrition, having steered the new global scaling up nutrition movement and serving as the chair of the Sun Executive Committee. Meera has been one of the principals for the aid architecture for nutrition within the G8 and G20 process and was named a founding member of the Catalytic Financing Facility for Nutrition, later renamed to the Power of Nutrition. Additionally, Meera led the development of the first global investment framework for nutrition that was released in 2017, the original to the updated version that we'll talk about today. Through these many critical ways, Meera Shekar has helped shape the global nutrition agenda to what it is today. In today's conversation, we'll delve into the status of global nutrition and the newly released World Bank updated investment framework for nutrition. You'll hear Meera explain the challenges facing global nutrition, what the investment framework is and how it can help low-income countries, and the opportunities in 2024 and 25 to utilise this framework to drive progress on nutrition and SDG 2. Let's get into it. Meera, welcome to the show.
Thank you. It's a pleasure.
It's great to have you with us. I want to dive straight in. So, what are the key nutrition challenges facing the world today? And can you explain a little bit about what we mean by nutrition? And when we also say malnutrition, what do we mean?
So let me start with the second question first. What do we mean by nutrition? Most people consider undernutrition. Think about children who are stunted or wasted or women who are anemic. That people think of that as nutrition. But actually, the term malnutrition includes both undernutrition and what we refer to as overweight or obesity. So we try and address both of these issues in the work that we do. In terms of the challenges that exist, there are many. First and foremost, we know that there are persistently high rates of child stunting, meaning children being short for their age across the world, approximately 148 million children that are stunted. This is despite the fact that there has been significant progress, a 44% reduction in stunting rates over the last few decades. But the progress is still not fast enough to achieve the SDG targets. And then at the same time, anemia rates, 3 in 10 women in the world are anemic. And we're seeing, unfortunately, anemia rates going up instead of going down. And concurrently, which sounds very counterintuitive, we're seeing obesity rates go up in the world as well. Often in the same countries that have high child stunting rates and high anemia rates, and sometimes even in the same households, we see higher obesity rates. And people used to think, oh, obesity is a problem of rich countries, rich people in rich countries. That's not true anymore. 70% of the overweight or obese individuals actually live in low and middle income countries. So lots of challenges, as you can see.
Given this, why, it's maybe obvious, but why does the World Bank prioritize nutrition and why does it affect the work of the World Bank?
As you probably know, the World Bank's mission is ending poverty on a livable planet. So long as we have malnutrition in the world, it is unlikely that we will really be able to end poverty. Why is that the case? Because malnourished children, they learn less, they earn less, and they have lower economic productivity, which means countries have lower productivity. And so getting out of the poverty trap is much harder for people who are malnourished, both underweight, undernourished, as well as overweight or obese. And the World Bank has prioritized both what we refer to as financial capital as well as human capital. And if we look at the new Human Capital Index, nutrition is totally integrated into the Human Capital Index. So, unless we can improve nutrition, we really won't be able to improve the Human Capital Index. And again, the Human Capital Index includes both the undernutrition piece as well as the overweight obesity elements.
Tell me a little bit more about the investment framework for nutrition. What is it and what are the headline messages?
So in 2017, just before the last Nutrition for Growth Commitment Summit, the Tokyo N4G Summit, we had developed the investment framework for nutrition. And essentially, it was to help countries guide the commitments that they make at the summit. And now that we are getting ready for the next summit, the Paris Summit in 2024, the N4G Summit in 2024. We have updated that investment framework. And the update really essentially is around putting in the newer evidence that has become available since 2017 and including elements of obesity, which we did not do in the past. In fact, the world has really not focused on the obesity agenda in the past. So now we've added that in. We've also added, in addition to interventions that can reduce malnutrition, we put a huge emphasis on policy actions that are critical to reduce both forms of malnutrition, undernutrition, as well as obesity. And I think you'll be pleased to know that we've added specific elements around gender and climate as well, and how all of these things link to nutrition. So, what we've developed essentially, the investment framework, is a compendium of cost effective interventions as well as policy measures that can help countries move towards SDG 2.2, the nutrition SDGs. And included within that are the financing estimates that are needed to achieve those targets. So, these become a guide for countries in terms of both making the commitments, but also then designing their programs as they move towards or beyond the N4G.
So it's a guide and it has there the information needed for that investment. So when we're thinking about the furthest behind that are suffering from the worst forms of malnutrition, whilst also trying to balance, I guess, preventing malnutrition through the delivery of healthy diets, this framework is designed to help. Is that correct? The way that it kind of helps people prioritize it within that.
Correct. What the framework does is it highlights to the countries, A, how much resources they need for their country to scale up these high impact interventions. Secondly, which are these high impact interventions? And it can be tailored to specific country contexts.
In terms of high impact interventions, can you just give me an example of one of those interventions just to help listeners understand?
Yes, sure. So recently there's been new research done on something called small quantity lipid based supplements, SQLNS, as we often refer to it. And the evidence shows that SQLNS, if it is provided to children, has the ability to prevent stunting and reduce child stunting rates quite dramatically. There's also evidence that it can prevent wasting, which is something we didn't know how to do in the past. So that's one example of a new intervention that is available. In addition to that, multiple micronutrient supplements for women, those have become available. The evidence is crystal clear, and the costs are a little bit on the higher side at the moment. But with economies of scale, we anticipate that those costs will go down as we scale up.
And so, if we're thinking about the investment framework, how does it help us as advocates advocate in the face of the global food crisis and climate crisis that we have?
First and foremost, for advocates, it gives them the ammunition that is needed to go and speak with ministers of health, even heads of state or other donors or philanthropies. And the fact that we can get a return of $23 for every dollar that is invested, that is huge. And there are very few other sectors that can give that kind of return. So that's one element of the advocacy that's useful. Second, advocating for the fact that improving nutrition will also improve climate elements. So, climate nutrition win wins. There are many of those that are identified in the investment framework. And then for the advocates, it's really important to remember that it's not just interventions, but policies that can improve diets are absolutely critical. Just as an example, taxes on sugar sweetened beverages absolutely critical. Many countries initially thought, oh, this is not going to happen. This is very hard to do. But currently, almost 57% of the world is covered by taxes on sugar sweetened beverages. So that just tells you that it's possible to do. And many countries are doing the right thing in terms of complementing these taxes with labeling and marketing restrictions as well. And we have evidence from countries that have done this well that this does lead to good results, improved diets, improved health outcomes as well.
Looking forward towards the end of the year, where we will see this IDA 21 replenishment, and this is the World Bank's concessional arm for low income countries. What are the opportunities for IDA 21 to deliver the nutrition financing recommendations set out in the investment framework?
I think a healthy IDA replenishment will mean that there's more resources for countries to access. As you know, IDA is a demand-driven model, so countries need to demand resources for whatever their development issues may be. If the advocates have done their job well, then countries will be demanding more and more IDA for nutrition as well. And we're seeing that happen, especially with the launch of the Human Capital Project. Heads of state have become sensitized to the importance of nutrition, and they are requesting more and more IDA. In fact, we've grown the IDA pot for nutrition from what used to be in tens of millions to over $2 billion a year over the last several years. So we anticipate a healthy IDA will make more resources available for the countries. In addition to that, under IDA 21, a new president, or not so new president anymore, Ajay Banga has highlighted 6 new global challenge programs. Among the 6 global challenge programs is a program on food and nutrition security. And nutrition is front and center in the what we call the FNS GCP. So we anticipate that IDA will continue to be a huge resource for nutrition. And the current estimates in the investment framework show that the World Bank, the Gates Foundation, and the government of Germany are the 3 groups that have actually increased their investments in nutrition over the last decade or so, while many other partners have not necessarily met that challenge.
No, that's important. And as we look ahead also into next year, France is going to be hosting the Paris Nutrition for Growth Summit in March 2025. And you've mentioned the Nutrition for Growth Summit has a relationship with the investment framework in terms of as a catalyst. What do you hope to see from this event?
The investment framework tells us that we need roughly $13 billion per year for nutrition to scale up the high impact nutrition interventions in the countries that need those. In addition to that, we need to put in policies in place, the right kinds of policies in place. What we hope is that we will get these strong commitments, financial commitments from donors, from philanthropies, from national governments themselves, as well as responsible commitments from the private sector as well. That's one aspiration over there. The second aspiration is around putting the right policies in place as well. And I keep emphasizing that over and over again. Just putting in money into interventions will not solve the problem. We need to put in policies in place as well. And again, those need to be part of the commitments that are made at N4G. And I want to give you just one example of the kinds of policies that we need to put in place. Well, let me step back. Let me say, we need $13 billion. But if we look at the trends in terms of financing that has been available for nutrition or that is likely to be available, we don't believe that traditional sources of financing will help us achieve those targets. So we need to look beyond the traditional sources towards innovative financing sources. And that includes what I had referred to earlier, taxes on unhealthy foods, which improves
Yep.
fiscal space in the countries themselves. That's just one example. The other example is repurposing agricultural subsidies. So, in many, many countries, there are huge subsidies, actually, something of the order of 700 to 800 billion dollars per year invested in agricultural subsidies. For example, fertilizers are often highly subsidized. What does that mean? Fertilizers are often overused because they are subsidized and they're cheap. That means there is runoff into the environment. It does more damage to the environment than benefit because excessive fertilizer won't increase the crop yields. So that's one example of a regressive subsidy. The other thing we see is that subsidies are sometimes, there is no policy coherence. From the health sector, as you know, we tell everybody, please eat less sugar because sugar is bad for your health. But from the agriculture sector, sugar is one of the most highly subsidized crops. There is no policy coherence. So, this is again one thing that we can all collectively, national governments in particular, but also donors can help support greater policy coherence so that we can get better health outcomes.
Do you see, Meera, any examples of countries that have been successful in doing this?
Yes, actually, lots of countries are starting to do that. As I said, on sugar sweetened beverage taxes and alongside labeling and marketing restrictions and stuff, many, many countries are starting to do that now. And like I said earlier, 57% of the world is covered by that. This thing. Countries like Chile and Mexico have done extremely well with that agenda. South Africa is working on it as well. Many, many countries are doing that, and it is possible to do. Even on what seems like a difficult agenda, which is repurposing agricultural subsidies, some countries are starting to think about it, work on it, and I'm quite confident that we will turn that corner.
No, it's absolutely critical. And I really love the fact that you're looking at this from a multidimensional perspective in terms of not only the investments to maybe fix some of the challenges, but also fix some of the causes and look at reduction of causes and that holistic view. And so I think the framework is really critical for us to, as advocates, to think about how we can use that as the pivot, I guess, for us to really think about what we're asking for and how we're approaching these key moments.
Yes, we've tried to do that. We've also tried to do in the framework, give advocates different things that can be done through different sectors. We've talked a little bit about what can be done, certainly through the health sector, through the agriculture sector, but through the social protection sector as well, because cash transfers have been scaled up tremendously in the face of all the crises that the world has suffered recently. And if we can make those cash transfers more nutrition sensitive, we can get more bang for the same buck out of the same investments.
Absolutely. Well, thank you, Meera, for joining us on the show, and thank you for your important work. It's really critical, and we're very hopeful for the coming moments. We'll see the right actions taken.
Thank you, Paul. It's a pleasure talking to you, and I hope we can get these messages out far and wide.
Thank you, Meera. You've been listening to Future Fork, a show that explores the world of food and the decisions we can make today that will shape our future. Future Fork is produced by Disruptive Consulting Solutions and supports the SDG2 Advocacy Hub. For more info, head to the website futureforkpodcast.com. This show was produced with strategy and production support from Wavelength Creative. So you don't miss an episode of Future Fork, make sure to subscribe to or follow the show in your podcast app. And while you're there, leave us a 5-star review. It really helps others find the show. I'm Paul Newnham, and I'll see you in the next episode.